is by Dr. Rebecca Erwin Wells. Dr. Wells is an expert in headache medicine and integrative medicine, having completed fellowships in both specialties through Harvard Medical School. She has NIH funding to research mind-body interventions for migraine relief, evaluating the efficiency and mechanisms of mindfulness for migraine. Dr. Wells is an Associate Professor of Neurology at Wake Forest Baptist Health in North Carolina, where she founded and directs their comprehensive health program and serves as an Associate Director of Clinical Research at their Center for Integrative Medicine. She graduated from the University of North Carolina, Chapel Hill with highest honors, Brody School of Medicine, East Carolina University, and Harvard School of Public Health, where she obtained her master's in public health. She completed internship and neurology residency at University of Virginia. She has been a Best Doctor of America since 2015, serves as treasurer of the Southern Headache Society, and has recently been elected to the board of directors of the American Headache Society. Her research receives frequent media attention, including interviews with Time Magazine, NPR, BBC News, Boston Globe, and Prevention Magazine. She has published many articles and presented frequently to national audiences as an expert in headache, mind-body, and integrative medicine. Welcome, and we can't wait to hear what you have to say.
Okay. Hello, it's so wonderful to see you all.
You too.
So let me, now that you can hear me, I'll share my screen again. And it is a pleasure to be here with you today with the Miles for Migraine group. We loved having the Miles for Migraine walk last year. It was so much fun to see patients and colleagues and family all come together for such an important event, and then today to be able to have this opportunity to talk to you about some specific content area that we hope you'll learn from. Dr. Strauss just did a phenomenal job walking through treatment options to acutely treat migraine and come up with an appropriate plan, and I'm really excited today to talk to you specifically about mindfulness, because as many of you have probably experienced side effects to medications and have had challenges with medications. And so I can do research to evaluate mindfulness in migraine specifically. So many patients with migraine experience side effects from medications or can't tolerate them. And so I've been really interested in seeing if mindfulness is something that could be used as a treatment option, whether it's in place of or in addition to medications. So first, I want to begin by defining mindfulness meditation. It's really become a buzzword, and I think it's important to understand the concept of mindfulness. And then I want to go through evidence for mindfulness and migraine. There's been a lot of research that's been conducted in this field. And then I also want to explore the idea of mindfulness and how you may be able to incorporate it into your life. Are the slides moving appropriately? Are they going?
Yes.
Okay, great.
They are.
So I have no disclosures. So first, the term mindfulness is used frequently by many people. So here is a nut that is described as being mindful. Here is a burger place that has a more mindful burger. There is a color now that Sherwin-Williams has called mindful gray. And so I joke or I laugh about it because it's really become a buzzword. So what is mindfulness? So mindfulness is the act of paying full attention to whatever is happening in our present moment. And one of the key aspects of mindfulness is the attitude with which it's engaged. So there's qualities of openness, non-judgment, and curiosity. So mindfulness is something that we all have capacity for. We were born with the ability to be mindful. And so mindfulness meditation is a practice that can enhance our ability to access our own capacity to be more mindful. And mindfulness meditation is really a secular contemplative practice. So although it has, meditation has long historical religious roots, the actual practice of mindfulness meditation is not specified within the context of a specific religion. And the goal of mindfulness meditation is to cultivate attention and awareness. And through this practice of meditation, individuals can increase the likelihood of being more mindful in their daily lives. So one of the key aspects of mindfulness that's really important is understanding how mindfulness can be effective. And so typically in our day-to-day lives, we experience a lot of stimuli that come in, and we normally just react. With mindfulness, we're given the skill to be able to take a break, and that can be momentary or it can be days, where you have an input, and through mindfulness, you get to choose the response that you're then going to make. And so there is this power in having the choice of how you are going to respond to a particular input. And like I mentioned, it has long historical religious roots, but I put up these two researchers because they've had significant impact on the field. So the first is Dr. Herb Benson, and he was a researcher at Harvard who was the first one to begin to demonstrate that the relaxation response can have physiological benefits, specifically decreases in blood pressure and heart rate. And this was a really powerful change in our view of science, that doing something like that involves relaxation can actually have biological changes that are meaningful in our health. Dr. Jon Kabat-Zinn developed the Stress Reduction Clinic in 1979. And this is a program that he developed that has now been practiced by over 20,000 participants worldwide, over 8,000 healthcare professionals, and there are over 250 programs in hospitals across the world. And so both of these researchers and pioneers in the field really led to significant increase of research in these areas, as well as media interest. So the program that Dr. Jon Kabat-Zinn developed is called Mindfulness-Based Stress Reduction, or NBSR. And NBSR involves 8 weekly classes plus home practice. And individuals are taught a multitude of different mindfulness practices that they can engage in, such as body scan, sitting meditation, yoga, and mindfulness. And so the goal is teaching individuals to focus on the present moment and practice without judgment. So what's fascinating is that mindfulness meditation really goes beyond just relaxation. So we can sit in front of the TV and watch a show or a movie, something on Netflix, and we can become relaxed. But mindfulness meditation is an intentional strategy that engages our cognitive processes, which allows us to increase our ability to attend, so increases attention regulation, more tuned into our body sensations, and that's called interoception. So we become more tuned in to our body sensations. In addition, we're able to regulate our emotions better, as well as become more non-reactive and develop something called metacognition, which is the concept that you're able to distinguish your thoughts from yourself. So for example, if you have the thought, I'm hungry, typically you have a thought and you immediately react, okay, I need something to eat. But if you actually say, okay, I'm hungry, and then let yourself stand back and think, okay, that's a thought. Am I really hungry, or am I thirsty, or am I tired? Like, what does my body really need right now? And that can be really powerful to be able to give yourself that capacity to look at your thoughts as independent from who you are. There's been significant media interest in mindfulness specifically, as well as research interest. And these are a multitude of different researchers who have engaged with people. This is John Kabat-Zinn presenting to the Dalai Lama. Richard Davidson's a big neuroscientific researcher, also with the Dalai Lama. We've got Deepak Chopra with Oprah. We've got John Kabat-Zinn with Andrew Weil, and we've got Andrew Newberg. So we've got a lot of researchers who have really brought this into mainstream. And what I want to point out is that over time, this is a graph that on the x-axis we have the years from 1970 to 2015. And on this y-axis, we have the number of articles in scientific journals. And on the right y-axis, we have the number of media articles in newspapers. And so you can see from both scientific articles as well as news media articles, there, especially around 2000, just dramatic explosion of both research as well as new media interest in meditation. So I was really interested in seeing if mindfulness is a treatment modality that could be helpful for adults with migraine. And so I conducted a pilot study of 19 individuals who participated in either mindfulness-based stress reduction or continued their current treatment. And most patients were on a daily prophylactic medication, and they were able to continue all of their medicines during the study. And so this was a treatment option on top of what they were already doing. We found that most participants were able to participate in the intervention. We didn't have any dropouts or adverse events, and individuals were instructed to practice at home 30 to 45 minutes a day. And in this study, their average home practice was 34 minutes a day. So the study was small, which meant it was underpowered to reach statistical significance in our outcomes, but we did find that those who learned to practice mindfulness had less frequent headaches, less severe, and they were also shorter. In addition, disability scores dramatically decreased. We conducted interviews of all of the individuals who participated and found that some of the factors that participants described as occurring through the practice of mindfulness was that they became less reactive in their day-to-day lives with their emotions. They had decreased of pain catastrophizing. So this is a really powerful concept. The idea that you have a sensation of pain and you cognitively expand out that thought. So the example I like to give is a college student who's studying for an exam and suddenly begins to have a headache. And so they think, oh no, here comes that headache. And then they think, I'm not gonna be able to study for this final exam. If I don't study for this final exam, I'm gonna flunk this class. If I flunk this class, I'm gonna probably flunk out of college. If I flunk out of college, I'm gonna have to go home and talk to my parents, and they're gonna be so upset and have some huge argument, they could end up getting divorced. So the idea that a headache is coming on could lead to the idea that the parents are going to get divorced and the student's gonna drop out of college. So it's a really powerful one that often happens with migraine because migraines can become so painful and because they can have such a big impact on a person's life. This idea that anytime one begins, the emotional reaction to it can be very, very powerful. So when we think about, how is this working? Like, how is mindfulness potentially helping people with migraines? My hypothesis is that there's two potential mechanisms. One is that it potentially gives individuals a non-reactive approach to life stressors. So we all have stressful events that happen in our lives, and we're not going to get rid of all of the stress that we're experiencing. I mean, just think about the last month alone and all of the stress that we were going to experience, and a lot of it's out of our control. And so mindfulness gives individuals ability to change their reaction to the events. And like I showed prior, it gives the choice to decide on what the response is going to be. And in doing so on a daily basis, over time, that may decrease our emotional responses to stress, so that stress then has a less of an impact on headaches. And for many patients, stress is the #1 reported trigger for headaches. And so if stress is no longer having such a powerful role, then maybe mindfulness can be helpful. It's also possible that through mindfulness, individuals learn how to change their perception of sensory events such that the emotional attachment to the pain becomes less. So I like to think that about this, the way I like to think about this is that everyone in the world has a capacity or a threshold for having a headache. And what we don't know is intervention like mindfulness lowers an individual's baseline level of where they are, or if it raises that threshold for the likelihood of having a headache. So we are now, based on that pilot data and the 19 participants that we did, we are now conducting a much larger study. And we have been recruiting patients for it, and we are done running the study, and now we're doing the data analysis. And what I want to point out to you is that we had significant interest in our study. We did Facebook Lives, we did advertisements on social media, and what I want to point to is this number of the impressions. So our community in Winston-Salem has 250,000 people, approximately, and we really targeted our social media advertisements to our community, and so to have the number of times a Blade, which is the impressions, be over 1 million, really demonstrates how this was a research study that many people were interested in. We also had a lot of providers who were interested. We had over 1,700 online provider referrals and over 100 direct referrals from doctors, because a lot of doctors find challenges finding appropriate treatment options. And so this was a research study that many people were interested in. So I'm really excited because hopefully in the next year, we'll have some exciting data to present that will help understand the role of mindfulness for migraine. I want to point out the multitude of studies that have been conducted of mindfulness and migraine. And what's fascinating is I just conducted a systematic review of all of the studies that have been conducted. And what is really interesting is that people all over the world are conducting studies looking at mindfulness and headache. And we've had studies in the US, in Italy, Germany, Iran, and Australia. And it really goes to show that mindfulness is something that really has cross-cultural interest and applicability. In addition, there's been several other studies that have been conducted and published just in the last few years. Mindfulness-based cognitive therapy, which is a combination of both cognitive behavioral therapy and mindfulness. And Dr. Betsy Singh in New York just conducted a study and found improvements in headache-related disability with this intervention. Dr. Licia Grazzi in Italy did a really beautiful study where she took adults who had chronic migraine and medication overuse headache, and all the patients were withdrawn from the offending medication, and then they were given the choice of whether to choose to go into a group that learned mindfulness or to then go into a group that started a daily prophylactic medication. And of those two groups, both groups had a decreased reduction of their monthly headaches of 8 to 9 days per month, and both groups had decreased medication overuse in that. And so it showed that individuals in both modalities had significant improvement. So that was really interesting. And a study that just came out showed that a program similar to the study that I did of mindfulness-based stress reduction, but called Enhance, because it had extra mindfulness classes, compared to stress management, decreased headache frequency and disability. And they had MRI evaluations conducted and showed that the brains of individuals who learned to practice mindfulness had an improvement in cognitive efficiency. So this is a really exciting time in the field of mindfulness and mindfulness, because there are going to be a lot more studies in the next few years. So specifically, I mentioned the study that I'm doing, and you can see that several others are either in the process of conducting a study or will soon be doing it. So it's really an exciting time. When the COVID pandemic began, one of the things that I recognized was how stressful it was, how much uncertainty and anxiety. And so I began conducting mindfulness sessions for our patients. And I was inspired by my colleague, Dr. Licia Grazzi, who is a neurologist and headache specialist in Italy. And I was communicating with her early on because I had met her last year at a headache meeting. And when Italy was hit first, I reached out to see how she was doing. And in the midst of the dire circumstances in Italy, she said she had started teaching her headache patients mindfulness. And I thought that is so beautiful, and that's something I can do too. And so I've been doing mindfulness sessions for patients. And if you're interested, there's the email that you can email us, WFBH for Wake Forest Baptist Health, _mindfulness@wakehealth.edu. And we are continuing, we're doing live sessions each week of mindfulness. So if you're interested, feel free to email us and we will send you the information. In addition, we also have a virtual mindfulness session that you can participate in anytime. And so that is a pre-recorded session that I conducted, and we created a brief survey before and after. And so if you're interested, we can also send you the link to the survey. And then after you finish the survey, you'll get the mindfulness session that you can do at any time. So I'm going to come back to this mindful moment in just a moment, actually, because I want just to take a first, make sure we have time. Often the most common question I get is, okay, so I'm interested in this, where do I begin? And I just want to show you a few resources, and then we'll take a mindful moment. So here are a lot of great books that are on this topic. The two instructors that I have really found a lot of value from, and that I've done meditation retreats with, are John Kabat-Zinn, this Mindfulness for Beginners, and Sharon Salzberg, or Real Happiness. So those are both books I definitely would recommend. Although retreat centers probably are not happening now, at some point in the future, if you're ever interested, a retreat is a fantastic opportunity to really get engaged in the practice of mindfulness. I also have listed here a multitude of YouTube videos and websites that have been developed. We're in the process of accumulating a massive list that hopefully we'll publish soon of all the mindfulness opportunities, and here are just a few of them. In addition, there's a multitude of apps looking at mindfulness, and these are some of the most common ones. So let's go back and just take a brief mindful moment so you can understand what I'm talking about when I say practicing mindfulness and mindfulness meditation. So if you feel comfortable, you can sit in your chair, uncross your arms and your legs, and gently close your eyes or open them softly, whatever you feel most comfortable, and come into a dignified posture. And bringing your attention to your breath. Not trying to change or alter your breath, just bringing your awareness to the breath. This life-giving force of breathing. Each in-breath, a new beginning, and each out-breath, a letting go or a letting be. You may notice your breath most at your nostrils, or at your chest, or at your abdomen. Wherever it is that you notice the sensation of the breath strongest, bringing your attention there, resting in awareness. As thoughts come into your head, gently letting them float away, like a butterfly floating away, flittering away as you return your attention to the breath with gentleness and kindness. Just noticing where your mind has wandered off, and with compassion, bringing your attention back to the breath. The mind will inevitably wander off, and that's okay. The magic moment is when you become aware that your mind has been hijacked. Because in that moment, You have the opportunity to be really different. Rather than getting angry or frustrated or irritated with yourself, this is an opportunity to simply let go and be kind, gently and with compassion, bringing your attention back to the breath. And as you feel comfortable opening your eyes, and coming back to this room. I've been very thankful for all of the research support I have, and I have a lot of wonderful help to conduct the research that I have. So I'm very thankful for all of the engagement, and I thank you for your time today and for Miles for Migraine giving us the opportunity to connect with each of you.
Thank you so much, Dr. Wells. I have to come back.